Hi, Jenise with Giving Children Hope, and I'm here with Greg from the International Medical Health Organization. Did I get that right?
Yep.
And we just kind of started our own almost news program because there's so much news going on around the world that it's hard to get access to on mainstream. So it's just like GC Hope TV, and we'd love to hear about what's going on in Sri Lanka and what the needs are and kind of what we're going to do together to help. So why don't you first tell us about what your organization, the history, the mission, and what you guys are doing.
Okay, so I work with the International Medical Health Organization, also known as IMHO, and we've worked predominantly in Sri Lanka for the last 7 years, and our focus has been mostly on the north and east, which we've done because of the lack of development, the high levels of poverty, and the fact that it is where the Civil War has been taking place over the last 3+ decades. And so the current crisis that we're talking about right now is, finally after almost 3 decades of really intense fighting, it's finally come to a head, and the rebel group has been beaten back to a very, very small area. And as they retreated, they took several 100,000 people with them, which over the last 2 months have been flooding out into IDP camps, which we're now working with. So our organization has been kind of trying to get aid, particularly food items, into the conflict zones itself. And we were the first group to be able to do that. And then the other side of it is we're working in the IDP camps, where there's upwards of 160,000 people right now, and then just continually growing by the day.
And we were talking before of how long you thought it was going to take for those people to get settled, and how long did you say?
Right. Well, I mean, and what they're saying is take 2 years, probably to resettle all, will be more than 200,000 people by the time it's over with, to completely resettle them and to get them back with some livelihood. But then I think what's important to keep in mind is that a lot of these people were already displaced numerous times over the last couple decades, and they've been kind of permanent IDPs in their own country, just kind of going wherever they thought it was safest, where they could survive. And unfortunately, under this current crisis, there have been confirmed by the UN 6,500 casualties within the last 3 months. But I mean, unofficially, that number is, I'm sure, from my own personal knowledge of it, it's much higher than 6,500.
Wow. And there's a couple hospitals that we're going to work together to help support, right?
Right. So there are several hospitals within the region that are serving the IDP populations. And so the one that we'd like to work with first is called Manar Hospital in Manar, which is in kind of at the heart of the Northeast. And it's a hospital that has about 200 bed capacity, but they have over 1,000 people sleeping outside on the floor. We've seen the pictures; they're really disturbing. And it's not just small injuries or anything. It's a lot of people with some really serious injuries, amputations. There have been confirmed cases of starvation. Lots of children have been dying of waterborne diseases or diarrhea, things like that. So we'd like to work with Manar Hospital first, and then outside of that, there's Chinkomli General Hospital, which is also a government hospital, and then there is the Babunya Hospital, and the fourth one actually is Jaffna Hospital, which is a little bit. They've received some IDPs, but that's kind of a fourth one that's a little bit out of the actual affected area right now.
Okay. So we're working on some requests for hospital beds and wheelchairs and maybe some other things. Looking to ship this out right away, and you're on your way there shortly.
Yeah, I'll be there next week, and then I'll be there for 2 weeks, and I'm hoping if access is permitted, then I'll be actually going to the IDP camps and seeing for myself and documenting what's going on and what the needs are.
So that's what we're working on. That's what's happening in Sri Lanka, and that's how you can get involved and help. So thank you.